Welcome to Farmer Pro Mastery Hub. Today we'll be looking at the topic understanding diarrhea. There have been a lot of misconception about the topic diarrhea, and in this video I hope to clarify it. Diarrhea is defined as the passage of loose or watery stool at least 3 times in 24 hours. As pharmacists, we must note this threshold. This is because we want to distinguish between digestive upsets and true diarrhea. Because in digestive upsets, we are looking at bloating, mild stomach discomfort, while true diarrhea involves the passage of loose or watery stool 3 times a day in 24 hours. So as a pharmacist, you have to be able to distinguish whether this is a digestive upset or it is diarrhea. Diarrhea is dangerous, and this is primarily because of 2 major risks: the risk of dehydration and malnutrition, and this can lead to death. In major cases of diarrhea, you find out that if it's a child, the child is usually dehydrated, and when there's dehydration, there's electrolyte imbalance, and that can worsen the situation faster, leading to death. So it is important for the pharmacist to understand that diarrhea is not a standalone disease. It's just like fever is not a standalone disease, but rather it is a symptom of an underlying issue, which could be an infection, an intolerance, or it could be anything. So this distinction will help to guide patient management and referral decisions, because when the pharmacist understands this, the pharmacist will know when to refer and what to do. So this is a classification of diarrhea based on duration. We have acute, which is less than 14 days. We have persistent diarrhea, which is from between 14 to 30 days. We have chronic diarrhea, which is above 30 days. Now, an understanding of this classification will help you know what to do at all time. Now, in chronic, which is diarrhea that lasts above 30 days, it's suggesting that it is a serious condition and you have to refer. Now, common causes of diarrhea. 1, we have drug-induced diarrhea, which is diarrhea that occurs as a result of a particular drug. Drugs such as antibiotics like amoxicillin and clindamycin. These antibiotics can disrupt the normal gut flora, which could lead to diarrhea. Also, other drugs like metformin and magnesium-containing antacid, they are well known for causing diarrhea as a side effect. So number 2, another common cause is food intolerance. Some people are lactose intolerant and some people have gluten sensitivity. Now, this often presents as chronic or recurrent diarrhea after ingestion of specific food. Some people, once they eat a particular food or a dairy product, it causes diarrhea for them, and as a pharmacist, you have to advise the patient and track the patient properly to know what causes his or her diarrhea. Then number 3, we have traveler's diarrhea, and this is usually caused by bacterial infection like Escherichia coli. This type of diarrhea occurs after exposure to contaminated food or water, often during traveling to developing countries, or when you travel interstates, when you go to another environment and you are exposed to contaminated food or water, it could cause traveler's diarrhea. Now, when do you refer? When there's blood or mucus in the stool. Now, this is often a sign of an infection, inflammation, or even colorectal cancer. Bloody stool can indicate conditions like invasive bacterial infection, for example, Salmonella, Shigella, or inflammatory bowel disease. Now, referral is essential here because further investigation needs to be carried out. Another points that you have to consider so that you refer is high fever. A fever suggests a systemic infection. So when a diarrhea with a high fever could indicate bacterial or viral infection that require medical intervention. So if the patient is having a high fever and the patient is having a diarrhea, you know that this patient has to be referred. So another point, at number 3, we have signs of severe dehydration. So signs of dehydration include dry mouth, sunken eyes, and reduced urine output. So severe dehydration can be life-threatening, particularly in vulnerable population. We're talking about the elderly or infants. So immediate referral and or rehydration therapy is critical. The use of ORS can come into play here. Another, at number 4, we have chronic gastrointestinal disorder. If you notice that the patient has chronic gastrointestinal disorder, you refer, because as a pharmacist, if you can identify this pattern, it will help you to provide better patient guidance, and then knowing when to refer. It's not like you are not doing your job. You are also doing your job by referring when necessary. Referral is important. Once you notice that the condition is critical, the goal is to save the patient. At number 5, we have prolonged duration. When the diarrhea has lasted for a long time, greater than 2 days in adults, and then greater than 24 hours in children. Remember, because of severe dehydration, you can lose a child. So once you notice that, you refer. So any diarrhea that lasts beyond this frame will indicate that there's an underlying condition, which could be an infection, a malabsorption, and this will require medical investigation. Then at number 7, we have recent antibiotic use. When you notice that a patient has used an antibiotics recently, especially the broad spectrum one, because they can lead to Clostridium difficile infection. If you have not watched the video on Clostridium difficile infection, please do. This will help you have a better understanding. So this might cause severe life-threatening diarrhea, so you refer for stool culture so that the proper investigation can be done. And then at number 8, we have weight loss. When there's an unexplained weight loss which is combined with diarrhea, it's the signal that maybe there's a chronic underlying condition. It could be cancer, it could be inflammatory bowel disease, or malabsorption syndrome. So you refer for further diagnosis. Referral is not weakness. Referral is you helping the patient. Please don't forget this. So what is the role of pharmacists in over-the-counter management? Remember, because there's dehydration, rehydration is key. Now, ORS, they are the cornerstone of diarrhea management, especially when there's dehydration, because they contain electrolytes, and then this electrolyte and glucose now will help replenish the lost fluid and improve absorption. So pharmacists should recommend ORS to all patients with diarrhea, especially children and the elderly, and those who are at risk of dehydration. It is very important. So another drug we have here is anti-motility agents, that's loperamide. I made a video about loperamide. Please try and watch it. So it is important that as a pharmacist, you do not dispense loperamide for children under 2 years. And then in cases of bloody diarrhea or signs of infection, do not use loperamide. Please watch the video on loperamide to have a better understanding. Then zinc. Zinc plays a vital role in treating diarrhea, especially in children, because it helps to reduce the duration and severity of the diarrhea episode. It restores the intestinal lining and boosts immunity, and prevent future episodes of diarrhea for up to 2 to 3 months after treatment. So it is important, zinc and ORS. For loperamide, remember, they are contraindication. Don't give for children under 2 years. The next drug we have here is probiotics. Probiotics like Saccharomyces boulardii or Lactobacillus, they can help restore the normal gut flora, especially after antibiotic-induced diarrhea. You know, for antibiotics, it's killing both the good and bad bacteria. Probiotics are the good guys. They are the good bacteria. So probiotics is not the first line treatment. It's not the first choice, but they will help reduce the duration of the diarrhea. So what to avoid when you are having a diarrhea, or what to tell the patient when the patient come and the patient is having a diarrhea? What the patient needs to understand: the patient have to avoid sugary drinks, because this can worsen diarrhea due to their high osmolarity. They have too much sugar, and when there's too much sugar, what happens? It pulls water into the intestine, making the diarrhea worse. So if the patient is having diarrhea, ensure to tell the patient this. Also tell the patients, especially those that have lactose intolerance, to avoid dairy and fatty foods, because dairy can worsen diarrhea, especially in patients with lactose intolerance, like I said earlier. So fatty food, they're harder to digest and may irritate the intestine. You know, at this point, you don't want to irritate the intestine further. You just want to get where the patient wants to get where. So ensure that you tell the patient this, so that the patient will have a little comfort. So ensure to tell the patient to avoid routine antibiotic use. Remember, we are fighting against drug resistance. Now, antibiotics are not generally recommended for treating diarrhea. A lot of persons in Nigeria, antibiotics is their go-to, especially flagyl. Once they are having diarrhea, they just go for antibiotics, and this is not proper. So as a pharmacist, ensure to educate the patient why antibiotics should not be used without prescription. Now, another thing to avoid, like we said earlier when we were talking about loperamide, avoid the use of loperamide in children under 2 years. Avoid the use of loperamide when there is bloody stool. Always check the patient's age and clinical presentation as a pharmacist, because loperamide is contraindicated in children, and then in cases of suspected bloody diarrhea, because it will worsen the situation. Like I said, please watch the video on loperamide so that you have a better understanding on this topic. Now, children, especially infants, they are at a much higher risk of dehydration from diarrhea. So as a pharmacist, you should emphasize that ORS be used, and then you closely monitor their flu status. Again, avoid loperamide in infants, especially children under 2 years. So for the elderly patients, they may have multiple comorbidities, and this will make them to be taking several medication, and then they might be prone to complication. So you monitor for drug interactions and dehydration. So as a pharmacist, always consider the effects of the medications like diuretics, which will increase the risk of dehydration. Ensure you check for drug interaction as you are giving or dispensing any medication to the elderly. You want to ensure that the patient is safe and not harm the patient. Then pregnant women should avoid anti-motility drug like loperamide unless prescribed. And as a pharmacist, you know when the benefits outweighs the risks, right? So ORS is the safest option for rehydration. And then you tell them about dietary management, like the Bratz diet. They should prioritize the Bratz diet's method of diary management. So ensure you educate your patient always. So what are pharmacists' role in prevention and early detection? Pharmacists should counsel the patient on the risk of antibiotics overuse and the importance of using antibiotics only when necessary. Ensure you tell. A lot of persons don't know this stuff. They keep abusing antibiotics, and then they are not just causing problem for themselves, they are causing problem for all of us. So as a pharmacist, ensure you do your job. You encourage the patient to be vigilant for the development of diarrhea after starting antibiotics. If diarrhea occurs within a few days or weeks after antibiotics use, the patient should be advised to seek medical attention immediately. Also, if a patient presents with symptoms of diarrhea after recent antibiotics use, the pharmacist, so you as a pharmacist, you should rule out the possibility of Clostridium difficile infection, and then refer the patient for stool testing if necessary. Please ensure you watch the video on Clostridium difficile infection and loperamide. So advise the patient to wash their hands thoroughly, because Clostridium difficile spores are highly contagious and they can spread easily. As a pharmacist, also protect yourself and protect the patient at all times. Always remember this. So finally, to all healthcare professionals, always give your best, keep improving yourself, always protect yourself and the patient at all times. If you found this information helpful, don't forget to like, share and subscribe for more. Remember, this is where pharmacy meets mastery. See you in the next episode.